Hi everyone, Dr. Abdullah bin Zubair over here, a past research fellow from Mayo Clinic. Today for our mock interview session, we have a student from Pakistan, Dr. Waqas, who is currently interested in applying to internal medicine this year. So we have him over here. Hi Waqar, please introduce yourself and let us know about your story.
Hello, Dr. Abdullah. Thank you very much. My name is Mohammad Waqas, and I'm a medical graduate from Pakistan. I graduated in 2005 from Gomal Medical College, Residency, Pakistan. And after my graduation, I did 1 year of internship at a teaching hospital. I'm a son of a school teacher, and I was born in a very small village of Birismil Khan, Pakistan, which does not have basic facilities, healthcare system, and schools. At the age of 11, unfortunately, I had to leave my people, my family for better education. And since then, I've been living away from my family, from my people, which has taught me resilience, independency, uh, adaptability to work, and a kind of diversity. Outside my medicines, I'm interested in sports and I'm a passionate soccer and a cricketer. Also, in my free time, I read books and I have good interest in human behavior and learn more about the nature. I'm looking forward to talk more about me as well as for the program. Thank you very much.
So, Waqar, you had a really good opening. You told us a bit about yourself, then where is your background from and what your parents do. And I really respect that the fact that you gave us the opportunity to actually learn about your story. And the really good point which you gave was your self-defining characters, like what it taught you over the period of time, which actually program directors and faculty members really appreciate
Thank
because
you.
you have like told them about yourself except for your personal statement. And from there on, I would like to ask you a question which most of the faculty members do, that where do you see yourself in the next 5 to 10 years? What is your plan about internal medicine and why did you choose internal medicine?
Okay. In the next 5 to 10 years, I see myself as a board certified internal medicine doctor and working for the betterment of people, especially people that belong to the backwards areas. Like I personally came from a very area where they don't have basic healthcare system, so I'm more interested in serving people that are living in underserved areas.
So, why did you choose internal medicine? I didn't get the clarity of the answer that why internal medicine and what fellowship you're going to choose afterwards. What the plan do you have in your mind?
Well, my interest toward medicine and toward internal medicine is a very big, long story. I told you I came from an area where we don't have a healthcare system. When I was a child, we had this type of problems where you see people suffering from simple diseases get deaths, or they don't have proper management and things. And when I was a child, I pretty used to think about to be a doctor and help my people. And I think internal medicine is a kind of specialty where you have the opportunity to work and treat people with different type of condition. So this is the reason I'm more interested toward internal medicine, and this is the reason why I want to become a doctor.
Okay, that gives us more clarity about why internal medicine. So, what fellowship are you planning for?
Yes, Dr. Abdullah, at this time, to be very honest, I'm mostly interested about internal medicine, and then I plan to do internal medicine from your program. And during my internal medicine training, I will try to explore more options, more specialties. And when I found myself very good at the specialty, I would like to pursue this in the near future.
Well, that's a really open-ended answer, and most of the people actually does that because when you get into a residency program, you later on develop interest in different specialties. It might be rheumatology, it might be cardiology, it might be hemo, it might be critical care or pulmonology. So that's a really good answer from your end. The next question is that have you ever seen a patient in which you were more involved and it was a difficult patient, and you overcome all the obstacles to help that patient.
Yes, Dr. Abdullah, like working in a resource limited healthcare system is a pretty challenge thing. So, I had the opportunity and I was fortunate about to help that patient. We had a child, like she was 8 years old. She came to us and she was diagnosed with a case of malaria. She had been treated there like for a month and so for malaria, but no one was able to properly diagnose the case. I worked closely with the team, with the people, with my seniors, and we were lucky enough to diagnose the patient. And she was actually suffering from juvenile chronic myeloid leukemia. And later on, I even wrote case report on this as well, and we were able to transfer patient on time to a cancer center. And later on, I was even in touch with the patients, and luckily, she survived, and now she's doing pretty good. So I think this was the case that. I was more involved in the management of patient, to talking with the family, so that we can help her in the best possible way.
Well, that's a really interesting case, and I give you the full credit to actually express that to us today. Our next question is that which program directors usually ask our faculty members that is there any particular research paper that you're really proud of, or is it something like a star in your application?
Yes, Dr. Abdullah, I work on many papers, and I think each of every paper has its own story and it contributes to the literature in the best possible way. But this is one paper I would like to talk about, and that is thrombotic microangiopathy and chemo-naive pancreatic ductal adenocarcinoma. This is the case report, and I was lucky enough to work closely with the faculty of Brown University, and this paper tells us about the thrombotic microangiopathy can happen in patients who are not taking any type of chemotherapy. And this is the first ever case report that we are contributing to the literature, and I'm really proud of this paper.
Well, that's really interesting. So, how many observerships or US clinical experience did you do in the US, and where were they, and what did you learn from them? What was the difference between those rotations and doing rotations back in your home country?
Yes, Dr. Abdullah. Sure. I would like to talk more about the US healthcare system. I was lucky enough to be selected as very good programs. I did 1 month of rotation at Geisinger Valley Medical Center, where I rotated in the progressive care unit. I was involved in the pre-rounds, in the rounds, and every day I used to present two cases, and that was also my first experience to work in the US healthcare system, and I was really inspired by the coordination system between different departments that were taking place for the management of patient. I was also part of the blue codes rapid response team, and seeing patient that closely, I was really inspired by the system. Also, I had the privilege to work in ICU in Advanced Health Sebring, and also in the Houston Methodist. In the Brown University, I rotated at the floor and was lucky enough to know more about the patients. Like, in the US has a kind of very diverse system. They have very diverse people, and talking to different type of people, talking more about the different type of people have different type of diseases. So I was lucky enough to rotate at this place, and I learned a lot from the people, from the resident, as well as for the attending with whom I rotated.
Okay, that was a really brief answer. So, your rotation at Kazinger, what were the most important things you learned from the residents over there?
Yes, I think the most important thing was the teamwork. How important it is, like how important teamwork is in the management of patients. When I was involved in blue codes and rapid response team, and I was really amazed by seeing different departments going there and seeing patient and preventing patient. Like we had a patient, he's a kind of tracheal obstruction, and within minutes we reached there, and the critical care team was able to to serve the patient, and he survived. So seeing that patients closely, I was really amazed how good it is. And also like going there at 9 a.m., 6 a.m. early in the morning, and then coming late. So I learned more about how the residency works there in the United States.
Okay, that was really good from your side. I would add up that when you're describing more of your rotations, you should describe who you did it with and who
Yes,
were the faculty members. Did
yes,
you like rotate with the residents on call as well and stuff like were you there at the sign in and the sign out?
yes,
Moving on from that, what mostly programs do, they have a list of questions which every
yes,
faculty member is given to score on the basis of the
yes,
answer. So I have two questions for you. First of
yes,
all, tell me about a situation in which you become you have a conflict with one of your co-residents
yes.
and you're in front of the patient. How would you tackle that conversation?
Yes, Dr. Abdullah, I personally think, well, working in a healthcare system, you and your colleague both are prone to a kind of different opinions, to a different, and conflict can arise. But luckily, I've never been in such a conditions, and in case in the future, I get or I become prone to any type of situations, I would like to talk to my co-residents and would like to hear more about his perceptions and would like to solve problem mutually in the office, not in front of the patient.
Okay, that's really good answer. So later on, are you put like what a faculty member would ask you
Yes.
that moving to the US to their program, what difficulties you might face during this transition? Can you acknowledge one or two of them?
Yes, Dr. Zubair. I think like coming from Pakistan, where you have a different type of system, and then coming to the US, there will be some problems that would have to face. But at this time, like I work for 6 months in the US healthcare system, and I personally think that I am mostly aware of the problems and have a good idea how to tackle these things. But in case in the future I guess anything I would like to talk with my seniors and would like to ask for the help and the guidance.
Okay, thank you so much. At mostly of the end of the session, like most of the people, they have like a 15-minute interview with
Yes,
each faculty member. So at the end, they usually ask that, do you have any questions for us?
yes.
So as a faculty member, I'm gonna ask you that, do you have any questions for me?
Yes, Doctor. I have some questions, and I would like to talk about more these. Like you have been working with the team, with the residents, with the senior, as well as with the intern. And here is my questions: what type of mentee and mentor relationship do you have with your resident, and specifically with the interns?
Okay, and what would be your second question?
And my second question is what type of clinical electives opportunities or research elective opportunities are available for the for the residents so that they can go and learn more about the other areas as well.
Okay, thank you so much. I'll give you a review about that. Just give
Yes,
me a moment.
yes,
Um, what I have learned from your session that you have been really open
yes,
towards taking constructive criticism,
yes,
and you have really described yourself, your story from your young childhood up till
yes.
now, and your US clinical experience as well. I would be really, really, really happy to tell the program directors that you're a really good applicant and they should surely see your application, and best of luck for the future.
Thank you so much, Doctor.